Welcome to Elite Pharma Notes. In this lecture, we are going to discuss about various letters of diseases along with their drug of choices. Let us start our discussion with letter D. Diabetes ketoacidosis, nothing but coma, is going to be treated with regular soluble insulins. Dermatophytosis is going to be treated with grisofluin. And diabetes insipidus is going to be treated with desmopressin. And diabetes insipidus, which is caused because of the lithium, then we are going to use amiloride. And we know diabetes are of two types. One is diabetes type 1 and type 2. Type 1 we have to use insulins, whereas for type 2 we have to use sulfonylureas. And dysmenorrhea is going to be treated with mefenamic acid. And now let us discuss regarding the E-letter diseases and their drug of choices. The first one is epilepsy, very important. Epilepsy is going to be treated with phenobarbital. In case of F letters, we have Fanconi syndrome, that is going to be treated with vitamin D, calciferol. And febrile seizures is going to be treated with diazepam. You have to give in a rectal route. And filariasis is going to be treated with diethyl carbamazide. And now discuss about the G letter diseases and their drug of choices. Gastroesophageal reflux is going to be treated with proton pump inhibitors. And gyardiasis is going to be treated with metronidazole. Gilles-de la-Tourette syndrome is going to be healed by haloperidol. Gonorrhea is going to be treated with ceftriaxone. Gout, in case of acute gout, we have to use indomethacin, and for the chronic gout, we have to use allopurinol. Graft rejection reaction is going to be treated with cyclosporins. And Graves' disease is going to be treated with radioactive iodine. This is very important.